Hello, my name's Deborah. I'm a research nurse and I'd like to give you some background information about a clinical trial for melanoma patients called INTERIM. About half of people with melanoma have an abnormal gene known as BRAF, spelt B-R-A-F, which can cause melanoma to grow and spread. Two drugs, dabrafenib and trametinib, are routinely used to treat patients who have the BRAF gene. The standard treatment is for patients to take both of these drugs as tablets twice a day, every day. Patients are seen in clinic every 4 weeks to check how they are tolerating and responding to the treatment. Used together, these drugs can increase life expectancy and they have been prescribed for years for some patients. However, their effect tends to wear off over time and the cancer can regrow in spite of the treatment. This is because the cancer becomes resistant to the drugs, so they stop working. One way of delaying this resistance may be to give the drugs intermittently, on and off rather than continuously. This method has been shown to be effective when tested in the laboratory. It's not unusual for patients to have breaks in treatment to manage troublesome drug side effects, and this doesn't appear to reduce the effectiveness of the treatment. We'd now like to test the benefits of treatment breaks to see if the drugs work better, and taking less of them can also reduce the possible side effects patients experience. INTERIM is a national trial funded by the National Institute for Health Research. It compares continuous versus intermittent treatment using the two drugs dabrafenib and trametinib. I will now hand over to Dr. Corrie, who will tell you about the design of the trial.
Hello, I'm Pippa Corrie. Clinical trials are essential if we are to improve outcomes for our patients. Giving patients the opportunity to take part in research is a valuable part of what the health service offers. INTERIM is a clinical trial with 2 treatment arms, allowing us to make comparisons. One group of patients will receive the standard treatment, as Deborah has described, taking dabrafenib and trametinib tablets every day. Patients in the other group will be given the drugs in a series of 4-week cycles, taking dabrafenib for 3 weeks, then 1 week off, and trametinib for 2 weeks, then 2 weeks off. People who are willing to join the trial will be allocated to one or other of the treatment arms at random using a computer program. The doctors and patients don't choose who is in each group. Taking part in this trial is completely optional, and patients who decide not to join the trial will of course continue to receive the standard treatment. Some people ask, isn't it better to keep taking the medicines rather than stopping them? Well, this isn't always the case. Sometimes more treatment can cause more side effects, which prevent treatment from being given as originally planned. And as Deborah explained, breaks in the treatment may delay the body's resistance to the drugs. To safeguard against the possibility of less treatment being less effective against the cancer, patients are asked to attend clinic every 2 weeks rather than every 4 weeks during the first 8 weeks of the trial. In addition, the first assessment scan is done early at 6 weeks after starting treatment, compared with after 8 weeks in the standard treatment. After that, all clinic and scan visits are the same as for the normal standard of care. Some patients ask whether taking part in INTERIM might delay the start of their treatment. If your doctor thinks that you need to start treatment immediately, this will be done, and you would not be offered the option to take part in this trial. But in general, any delay should be no more than a week. In any case, patients offered cancer treatment are usually encouraged to take a week to consider the options that they have. This is the same for a clinical trial. At the first visit, patients are given information about the trial, and they return a week later to give their consent, if they have decided that they do wish to take part. Treatment should be able to start straight away on the day consent is given.
As you can see, there are plenty of things to think about before you decide whether or not to take part in a clinical trial. You should have been given a patient information sheet for INTERIM, which explains more about this trial. Above all, it is entirely up to you, helped perhaps by your family and friends, to decide whether to join this trial or to have standard treatment. And if you do decide to take part in the trial, you can change your mind at any time. Please ask your nurse or doctor if you have any questions. And on the screen are a central email address and telephone number in case you need further information.